Welcome to Med Supervision Initiative. Clinical Officer General Program target groups are intermediate and finalist student for 2022 version. And today we are looking at hematology problem-based series. Specifically, the lecture will be focused on approach to classification of anemia part 1. Sure, those who have been members, we've done a lot in hematology. We've talked about approach to hemogram interpretation of whole blood count or complete blood count, and interpretation we've discussed, and we have a lot of problem-based learning where we even bring some exams relating to interpretation of full blood count, some OSC stations well explained. I would love also to inform you that the packages for intermediates for COG are variable for internal medicine, which is Med 220, pediatrics and child health, PED 220, surgery 220, with ophthalmology and ENT, OBGY, obstetrics 220, public health, which comes with health promotion and health education, health system management, which is HSM 225, mental health and clinical psychiatry 220. For finalists, it has also a package that comes with OSC, which is Objective Structured Clinical Examination. In addition, it has also what is called OSP, where we explain on how to do every procedure in clinical practice, step by step, and the procedures that are within or a must know for a clinical officer general. For those who are doing year 1, they have just started year 1, semester 1, year 1, semester 2. Also, it has included for the foundation. And what's available for year 1, semester 1, it is medical laboratory sciences, which comes in two segments. That is medical microbiology and immunology, medical parasitology. So it comes separately and detailed. So it's splitted from the old classification of biomedical sciences 110. So it's in line with the new revised curriculum. Then it also comes with human anatomy. So under this segment, we don't bring human anatomy and physiology together. So we have separated. Under human anatomy, we are providing mentorship for cytology and embryology, as well as gross anatomy. So it's very important also to take note that the anatomy that we give to clinical officers is directly clinical anatomy that's relevant also for clinical procedures that are within the scope of a clinical officer general. Then when it comes to medical physiology, also, we have also programmed it in a way that it meets all the 3 skills that a student or a clinical officer student needs to know. That is knowledge that's up to date to a level of a clinical officer, as well as the skills. So we provide information in medical physiology that is relevant for you to apply it in clinical practice. As well as we also make emphasis on the attitudes when you are practicing medical physiology. And as semester 1, we also provide mentorship in medical social psychology. And we link that to common clinical hints or clinical cues that are linked to this course, so that we are able to identify some medical social problems as well as psychological problems. Then we also provide medical biochemistry, and we make it very simple. Yes, and the medical biochemistry, most of the students, they are starting the introduction. Then what happens is that they get worried. They have been hearing that medical biochemistry is very difficult. But come to Med Supervision Initiative, we may have made medical biochemistry actually very simple and easier to understand. For example, we can explain to you about a carbohydrate in a simpler way. Okay, so when you subscribe, you're going to know actually to say when we say carbohydrate, apart from just saying of the elements of carbon, hydrogen, and oxygen, we'll just tell you in a simple way first to say actually we are just hydrating the carbon. When we put carbon in water, what we come up with is a carbohydrate, and we're able to demonstrate and show you illustrations. We provide even also clinical chemistry methods that are relevant for a clinical officer. For example, how do you use medical biochemistry? Subscribe for you to know more about it. The other one also is communication skills, medical, legal, and healthcare ethics. I'm sure for those who are doing semester 1, you are doing that course. It's a new course which is medical legal and a new inclusion, and we're able now to learn about tort law. What is tort law? So that come you subscribe and you learn medical law, so that you'll be able to know when to sign. How many days do you give when you are signing a medical form? How many types of medical form, and what are the legal implications? So those are the major courses that you are able to find. And then other courses for semester 2, you may also continue with bionutrition. This is biochemistry that is making more emphasis on nutrition, specifically clinical nutrition. Then we also have anatomy 2, which is systemic anatomy and systemic physiology. They are taught separately. Then we have pathology, a complete course, which is general pathology and systemic pathology. That's where you cover also the hematology. Okay. And under that course also we provide you skills where you have to know which common tests that you are supposed to order as a clinical officer, and what tests are supposed to know on how to interpret and make some links to the clinical practice. Medical pharmacology as well, we provide medical pharmacology and therapeutics. So we'll teach you on how to prescribe. First, we'll start with basics on how to classify the drugs, how they work, which drugs are available in Zambia, which drugs are available in Africa, and how to prescribe as a clinical officer. How do you try that knowledge? These are the major courses that you are going to find. And the other course that we provide also is clinical methods and procedures. So we're able to demonstrate, we have got illustrative videos, we're able to show you how to inject and how to avoid common mistakes during performing these procedures of injection. So it's very important that you subscribe. And this channel or this platform is not meant to substitute you from your respective colleges or universities. You have to attend your wards, you have to attend your clinical clerkships, you have to attend your revision from your respective schools, but this one is meant specifically to provide that reliable preparation for those who want to prepare for exams, even for those who want to prepare for enough knowledge for clinical practice, for future clinical practice. Okay, so we provide this platform. So thank you very much for your time. Today we are now looking at approach to classification of anemia part 1. Okay, so usually students, they have problems when it comes to hematology. No, hematology is a course on its own. Hematology is both a basic science and a clinical science. So you have to understand at what point will hematology become a clinical science, and at what point hematology remains a basic science. That's very important. And once you understand that one, you are also going to know how to practice effectively. Remember, you cannot practice alone as a CO or as a doctor or as a medical licentiate, just alone in a ward. You still need to work together with the basic sciences unity, which in this one we call it the laboratory or medical laboratory department. That's a department that actually deals with the basic medical sciences. Okay. Now, when we talk about classification of anemia, it's one of an important question you're going to find it. Whether you are doing MBCHB, especially on the preclinical sciences, you still find it also at clinical sciences during your rotations. If you're doing clinical medicine as a clinical officer, you're still going to meet this question about anemia during your intermediate or your final exam. So it is an important topic to discuss, especially on a classification, even when we are doing the practice. Okay, so we're going to do a quick review on the following: red cell count, hemoglobin, as well as red blood cell indices. So I'll just do a quick review, being that this topic was taught from the introduction of this course for those who have been members. So actually, when you look at the common hemogram in Zambia, usually it is going to have 8 major parameters. Okay. And parameter number 1, we are going to talk about white blood cell count, which we did. And we know that under the white blood cell count, there are also 5 differentials. Okay. And when we talk about differentials, we call them differentials because differentials are specific. They help us to distinguish or to understand what's going on within the defense system. Okay. For those who want to still get more information, please, you can review to lecture 1. You'll find a lecture entitled Introduction or to Interpretation of Full Blood Count or hemogram. The other parameter that you're able to find when you order full blood count is red blood cell count. So under the red blood cell count, it will also include the red blood cell indices. These are the ones actually that are helping us to make differentials when we are coming up with anemia. Remember, anemia is not a diagnosis. Anemia is just telling us the status of the red blood cell or hemoglobin concentration. And I would also want to remind everyone here that actually theoretically we talk about anemia. We can define anemia or measure anemia based on the mass of the red blood cell, but that in clinical practice we don't measure the mass of the red blood cell. What we do is the concentration of hemoglobin. That's very important. Okay. Now, hemoglobin, very important because hemoglobin actually it gives us or it provides us to understand the capacity of the body to carry oxygen. Okay. As you know that oxygen is very important, so hemoglobin is very important. Okay. So the other time we'll be doing some lectures in hematology. You are going to understand where about hemoglobin and how hemoglobin is formed and what is important. It's amino acids. I'm sure that when you subscribe, go to my medical biochemistry about proteins and amino acids, and you discover that actually amino acids plays a big role in the formation of the hem group. Okay, so this is how we carry out our mentorship programs. We integrate with other courses. Then we also talk about hematocrit, which is also known as packed cell volume. Okay, and this also I'm sure you know if you listen to lecture 1, it's also able to help you to calculate or come up with hemoglobin. Okay, just tells you the volume that is covered by the red blood cells. Okay, then the other one, it's the mean cell volume. This is very important. Okay, so the mean cell volume actually it tells you, it talks about the size of the red blood cell. Okay, the average content of hemoglobin of this single red blood cell. So it will tell you, it will talk about the size, and it's very important to know the normal range of mean cell volume, especially that we are going to discuss on the classification of anemia. The other one also is the mean cell hemoglobin. Okay, this tells you also the concentration of hemoglobin content, okay, per red blood cell. Then we also have the mean cell hemoglobin concentration. This gives you the relative percentage of hemoglobin, okay, and that's very important and tells you on the color. This is the parameter that explains about the color of the red blood cell. Okay, and I'm sure you know from the basic introduction we did, either under pathology, we said actually a normal red blood cell, 2/3 it's colored and 1/3 is pale or pallor, or it does not have a color. That's a normal anatomy of red blood cell. Okay, and when we talk about the diameter, 7.5 micrometer, and that also tell you that when you cross, those who like dissection, you find that actually it's a concave shape. So it's very important you can review to lecture 1, and that's why we are bringing here the mean cell hemoglobin concentration, or what we just want to look at it is how concentrated is the hemoglobin. So the more the hemoglobin is concentrated, then it's going to give you a color. Okay. Then we also have the red cell distribution width. I'm sure this one tells you the variation of the size. Okay, how many abnormal red blood cells are there? How many normal? How is the variation? Okay, and we have some good terms there. If we're looking at the sizes, if the RDW is high, of course, clinically we are going to find that in sickle cell anemia, and we may also find it in iron deficiency anemia. But when it is high, we will call the term actually 3 words. We have got 3 terms there which we may call anisocytosis. Okay, so when we look at an, we say it means not. Iso, equal. Okay, and you know cytosis, sites talking about the cells. So anisocytosis, we're saying the cells are not in equal size. That's what it means. Okay, don't be confused when you talk about poikilocytosis. Of course, that one tells you about the shapes, not necessarily about the sizes. Tells you about the shapes. So when you find different shapes, for you to get more, you can still go back to lecture 2, where you can find that information being explained. Um, as you can see, the red blood cell now here. This is just a picture on the red blood cell. In today's session, we'll look at the following. We're going to outline on the clinic, our clinical discussion actually will have the following. Defining anemia, which we've talked about, low concentration of hemoglobin based on the age and the sex. And we also look at the red blood cell indices used to diagnose anemia in clinical practice. Classification of anemia. Okay, there are so many classifications of anemia. Number one, we can classify anemia based on the red blood cell size. We can classify anemia based on the color of the red blood cell. We can also classify anemia based on the etiology, and we can classify anemia also based on the severity. So there are 4 classifications of anemia. Okay, but for today's lecture part 1, we are only going to talk about red cell size and the color. So for today, we are going to classify based on the size and the color. So meaning that we're going to center on the MCV and the MCH. When we talk about classification of anemia, before we can talk about hemocytic anemia, I'm sure some of you are able to see it. It's very important to take note that when we are classifying basing on the aspect of size, where we are using the MCV, it's very important to know that there are 3 types or 3 classes. Okay, and when we base on the color, it's very important to take note that there are not 3 types, there are not 3, there are only 2 based on the color. So when we talk about first step is to identify that there is anemia. And when we talk about this anemia, that is HB to start with. So when HB is low, okay, and HB can only be called low or anemia based on the age and the sex. That's very important. Okay, so meaning we have the male, we have the female, and we have the pediatrics. Sometimes I would want even to tell you that we can also talk about a newborn baby, we can talk about a 1-month baby, we can talk about a 6-month baby, we can also talk about 1 year to 10 years. And then from there, we'll be able to go to adult. Now, HB when it is low, okay, regardless of the sex, regardless of the age, that's a determinant for us to call it anemia. Okay, then second question is to know how are the sizes of these red blood cells. Are they having the normal size? Are they their size, are they reduced or are they large? Okay, so what parameter are we going to use? We are going to use the parameter of MCV. Today, clinical practice has become so easy because actually the lab provides us those results based on the automated hematology analyzers. But we can also do that manually. Okay, we can examine the film, the blood film, and we'll be able to see the red blood cells, able to look at their sizes, able to see their concentrations. Are they pale? How are the sizes? We can still identify that. But today's clinical practice, we are using more of automated machines. But that does not substitute the manual practice, especially for those who may be carrying out research. So it's also very important to confirm. Okay, so mean cell volume, when it is low, then we call that the red blood cell has a small size, that is microcytic. When it is in normal size, then we call it normocytic. When it is large, we call that macrocytic. Okay. Now, let's see what's next. We can see there, that's a film. So as I said, if you look at 2/3 of this red blood cell, you can see the color. But at the middle, it is pale. That's 1/3. That's how a normal red blood cell looks like. Now, when this cell picture, HB, reduces, the oxygen carrying capacity has reduced whilst maintaining the size. then we are going to call that normocytic anemia. Okay, so when you look at HB, if we talk about HB in male, then it is theoretically will tell you it is less than 13.5. Clinical practice will tell you it's less than 12. In female, we have two types of females. When we just say female in medicine, we say we are talking about non-pregnant. So when we specify to be pregnant, then that's a special group. But that should not confuse you. If you ask a question generally, what's a normal range? Just begin from the lowest margin in pregnant women and you go to the highest margin in non-pregnant women. Then you'll be able to get that question correctly. Okay, so it is from 11.5 to 16 grams per deciliter. So when it is less than 11, then we are calling that to be anemia. Then what will happen to the MCV? MCV in your books, it will show you 80 to 96 femtoliters. But in Zambian practice, African practice, Southern Africa, we have adopted to say actually it's up to 100. There's no significant change in terms of the size when we check on the RDW, where we're going to say no, 4 femtoliters is able to make a significant change. No, we have only noted that to have a significant change when it is above 100. Hence, that's the reason why we have adopted to say 80 to 100 femtoliters is considered to be a normal size of a red blood cell. Now, our objective for today, we are classifying anemia based on the size and the color. Okay, so normocytic anemia there, we have addressed it. Now, let's check on the MCHC, the mean cell hemoglobin concentration. So the normal range of mean cell hemoglobin concentration is 32 to 36 milligrams per deciliter. So usually, whenever the cell is normocytic, even the color, it is normochromic. That's very important to take note. Okay. You will not find a cell that is normocytic and hyperchromic. Actually, hyperchromic does not exist. Okay. There is no red blood cell that's able to concentrate above the normal color. Okay. So, whenever we talk about normocytic anemia, when we see the picture, we're going to find that the color is usually microcytic. Hence, this type of anemia, what does it mean? It is called, remember, normocytic. We have to define anemia first step. That is by easy to remember on and very simple concentration. Okay, so once the hemoglobin concentration is low, then we term that anemia. Then we want to know microcytic. We're talking about the mean cell volume to be less than normal. So meaning that the mean cell volume has to be lower than 80 femtoliters. Okay, let's see what happens. This is how the fume. Okay, if you look at this blood fume here, we're able to see the red blood cells. But how are we knowing that these red blood cells on this fume are actually small? Okay, we check on the lymphocytes. So once they are less than the lymphocyte has the same size with the red blood cell. That's a golden principle to remember. Okay, but if you are using full blood count results, it's very simple. Just check on the MCV, it will be less than 80 femtoliters, and you call that microcytic. So let's see what happens. Hemoglobin will be low for it to be called anemia. MCV, it will be less than 80 femtoliters. Now, what happens to the mean cell hemoglobin concentration? it will be also low. It's very important that you not find microcytic normochromic anemia. It doesn't exist, because once the red blood cells have reduced in size, it means that even the hemoglobin concentration has reduced. Hence, the cells actually loses its color, so it becomes pale. That's the reason why even when you are checking your clinical examination in the conjunctiva there, you find there's paleness there. So even when looking on your microscope, you are going to see that the red blood cells actually they will look pale. Why? Because you find that one third maybe it may be only the part that may be containing the color, but 2/3 may be pale. Let's see this film, a big film here. You can see that on the middle there. Okay, let me try to add some color there. I'll use blue for us to understand. So when you check here on the middle there, you find that it is more of what? It is more of pale. Hence, it will be microcytic hypochromic anemia. Okay, so where I've put blue, please, it's not a film. I'm just trying to show you what it means to be microcytic hypochromic anemia. As you can see, I'm shading the all pale region in this red blood cell. That simply means that much part of the red blood cell is pale. Okay, that's microcytic. So in this picture, we are going to call it microcytic hypochromic anemia. So a take-home message: whenever you find microcytic, expect to have hypochromic. Okay, you're not going to find microcytic hyperchromic or microcytic normochromic. No, what you're going to find is microcytic hypochromic. These are good questions for actually multiple choice questions, which is microcytic, where we are going to proceed there. As you can see on this film, what are you able to see here? You are able to see that actually the size of the red blood cells has increased. Okay, so they have become large, they are big, and we call that macrocytic. You know, macro means large, cytic means cell, and anemia, we're talking about HB being low. Okay, I think this principle we are up to date. Now, what is a picture when you're looking at the full blood count? Hemoglobin, of course, we know that it will be low. Okay, we know hemoglobin will be low, and MCV, it is above 100, meaning that the red blood cell has increased size. Okay. And when we talk about the red blood cell as increasing size, let me demonstrate a bit here by trying to actually highlight so that we understand. Okay, so I'm trying to shade this cell. So this is the red blood cell to appear like that. It's big. Okay, but still on the middle, it will be pale. Okay, and the picture we're going to find here that the mean cell hemoglobin concentration is normal in macrocytic anemia. That is very, very, very important to take note. Okay, so when we say macrocytic anemia, what are your expectations? Number one, HB will be low, mean cell volume will be high, above 100 femtoliters, but the mean cell hemoglobin concentration will still be in the normal range. So meaning that if we're to combine these parameters or these indices, we are going to call this type of anemia to be macrocytic normochromic anemia. So there is no macrocytic hyperchromic anemia. There is no macrocytic hypochromic anemia. Okay. So sometimes in the exam, they may ask you which of the following is not a correct classification of anemia. So just get these principles. Okay. Principle number 1, in macrocytic, the color of the red blood cell is normal. Hence, it is normochromic macrocytic anemia. Hope this hint has been so easily understood and we are able to remember. To get more for part 2, where we'll be now looking at the rest classification that will be based on the etiology and severity, and where we are going to integrate on how we manage anemia in clinical practice. We have outlined that following. We define anemia. Thank you very much. We talked about, we go back to summary hemoglobin concentration. Okay. What being low covered for. Okay. That simply means that the oxygen carrying capacity has reduced, and that is determined based on age, sex. Okay. Sometimes you may also talk about above sea level. Okay. But other key areas that we have used most of the indices or parameters on the full blood count, we looked at much on hemoglobin concentration. Okay. Also, we looked at mean cell hemoglobin, mean cell volume, as well as mean cell hemoglobin concentration. So mean cell hemoglobin concentration looks on the color. Okay. And then just from the name, how concentrated is this hemoglobin, so as to be able to provide a color. And then based on the mean cell volume, it is on the size, the volume of the red blood cell. So today we have learned that there are only 3 classifications of anemia. That is normocytic normochromic anemia, microcytic hypochromic anemia, and macrocytic normochromic anemia. That's very, very important. Take home message, please, is that based on the color, there are only 2 types or 2 classifications of anemia. That is only normochromic, that's normal color, and hypochromic, low color or low concentration of color. When we are classifying based on the size, there are 3 classes. That's microcytic, when the mean cell volume is less than 80 femtoliters, and so that's microcytic, and normocytic, it is between 80 to 100 femtoliters. Macrocytic, it is above 100 femtoliters. So when we are interpreting the results, we combine mean cell volume plus mean cell hemoglobin concentration plus hemoglobin. Okay. Then in the next, we'll look at how to combine even the red blood cell distribution we did on how to come up with a diagnosis such as beta thalassemias. How can I know? How can I differentiate beta thalassemia from iron deficiency anemia? How can I differentiate from even these other anemias? Thank you very much. And for further reference, you can check from Davidson Principles and Practice of Medicine, 23rd edition, Kuhlman Clark, Clinical Medicine, 10th edition. You can also go through the 21, and these are latest books actually. Mark Lloyd Clinical Examination, 14th edition, Hudson's Clinical Methods, an approach to integrate it into clinical practice. Thank you very much. All the best as you prepare your intermediate and final exams.